I'm Becky Cap. I'm the Senior Vice President for Biotherapies at Vitalant. This is a subject near and dear to my heart because I came into this space and that was the first thing that I thought we needed to do as blood centers. And so there's because we are doing GMP manufacturing of blood products. We've been taking donated cells and tissues, processing them and putting them into patients for decades now. So that seems like an easy transition. What we didn't realize is some of the same vocabulary that we have used in blood banking for decades is some of the same vocabulary used in pharmaceutical and cell and gene therapy manufacturing, but they mean entirely different things in those contexts. And so getting ready to be part of that manufacturing environment means understanding what those differences are, thinking about the risks associated and the expense associated with some of the clean room manufacturing that's going on in cell and gene therapy right now. I also think it's a big issue that blood banks are going to have to grapple with, that this manufacturing space is going to continue to transition. We are not at what that final picture looks like. It's a volatile and evolving space. And so thinking about what your footprint looks like and how comfortable you are leaning into a space that's going to change. I think those are some big questions. Eventually, I'm excited for the day that closed system manufacturing takes place in the same kind of CNC environment that blood products are manufactured in today, but it's going to be a long journey to get there. So this is an area that AABB has been so active in, so vitally important in for its entire history, bringing all of the stakeholders together, thinking about those, again, what are those things that are consistently held opinions and proofs in the data? What are the things where variability is acceptable? They understand how to put that together. And I have seen activity in the cell therapy space really moving those standards along. So I think the activity that AABB has taken on today has been vitally important. There's another, I don't want to spoil the surprise, but there's a volume that they are working on with multiple authors across the blood banking space to think about what that evolution looks like and how we need to frame the discussion around where we go next. I think people today are really looking at how we solve problems creatively from a regulatory standpoint, from a logistics standpoint, from a clinical standpoint. The level of the data, the quality of the data that is being presented at this AABB is really phenomenal. And I hear these sidebar conversations about, okay, how do we make this, not just make it real clinically, but how do we establish the impact on the regulatory framework? How do we use all of this information to move forward with patients and create higher levels of access for patients in their community?